Hi, for this video, I'm going to demonstrate the assisting a patient with meals or with eating. The first thing to do for this demonstration is to check the medical order for the type of diet prescribed for the patient. Then perform hand hygiene, which is already done. Then introduce yourself to the patient. Identify the patient by the two identifiers. Then explain the procedure to the patient. It is also very important to assess the level of consciousness of the patient. Assess also if there's any physical limitations or decreased hearing or visual acuity on the patient. It is also very important to ask if the patient has cultural or religious preferences, food likes and dislikes, if possible. Assess the patient's abdomen. Ask the patient if he or she has any nausea or difficulty in swallowing. Also, do not hesitate to offer assistance to the patient with any elimination needs. You should also provide hand hygiene or mouth care to the patient if needed. Remove bedpans or undesirable equipment and odors if possible. Then next, assist the patient to be in a sitting or high Fowler's position. Make sure to check if it is the correct tray before serving. Ensure that the hot foods are hot and cold foods are cold. Do not forget to ask the patient about his or her preference related to what food are desired first. Then cut the food into small pieces if needed. Then do not forget to observe the swallowing ability of the patient throughout the meal. If possible, sit facing the patient while feeding. You can also encourage the patient to hold finger foods or feed self as much as possible. Converse with patient during the meal as appropriate. Also, allow enough time for the patient to chew and swallow the food. Put a protective covering or towel over patient if desired. Remove the protective covering, offer hand hygiene as needed, and assist the patient to be in a comfortable position. When the meal is completed or the patient is unable to eat anymore, remove the tray from the room. Do not forget to note the amount of food consumed and note the volume of liquid consumed. After documenting all the information or result, leave the room. That's it for the assisting the patient with meals.